My name is Monica Schwartz. I'm an endocrinologist at Westchester Medical Center located in Valhalla, New York. Today we're going to talk about osteoporosis. Osteoporosis is defined by a low bone density and an increase in the fragility of the bone. It's the most common bone disease in humans. Osteoporosis is a disease that causes patients to suffer an increase in fractures, leading to a decreased quality of life, morbidity, and even mortality. It also uses up many socioeconomic resources. The good news is that osteoporosis can be prevented and treated successfully. It's important to know that in women, fractures are more frequent, especially after menopause. And in men, the fracture risk remains constant throughout their lives, and other medical conditions are important in assessing fracture risk. Osteoporosis is preventable and treatable. Unfortunately, most patients present only after a fracture, and that's when they're diagnosed with osteoporosis, instead of being diagnosed in an early phase when treatments can be initiated. Why do fractures cause so much morbidity and mortality? Fractures are painful, they reduce mobility, they change people's lifestyle, predisposing them to other illnesses. So why does osteoporosis happen? Bone is a living organism. It's constantly forming, it's constantly destroying itself. In other words, it's remodeling itself. When you have osteoporosis, that remodeling is disturbed. And for the most part, the bone destruction is exceeding the bone formation. Many diseases interfere with this process, worsening osteoporosis. But the good news is there's lots of preventive things that we can do to diminish the chance of developing osteoporosis and fractures in the future. So how do we prevent it? Exercise, stopping smoking, getting enough calcium and vitamin D, limiting the amount of alcohol that you take, all help in preventing osteoporosis. A common question that patients ask me is, how much calcium should I really get? Average adults need about 1,200 milligrams of calcium a day, and this changes according to your age, your overall general health, pregnancy, etc. How can you get enough calcium? Patients can often get enough calcium just from their diet. It's really about paying attention to how many servings and how many milligrams of calcium you're having a day. You can get these with your diet, but if you don't, supplements are easily available. Talk about it with your doctor so you get enough calcium in your diet. Vitamin D is also important in regulating bone health. Some of it is from our diet, some of it is from sunlight, but right now the recommendation is 800 international units a day. Often vitamins are necessary to achieve the proper amount in the bloodstream. If you have other medical conditions, you might need more vitamin D, and this should be discussed with your doctor as well. Exercise. Exercise, especially weight-bearing exercise, is extremely important in maintaining bone health. Right now, 30 minutes 3 times a week is the recommended amount. Smoking. Smoking is known to increase the risk of osteoporosis and fractures. One of the best things that you can do for your health is to stop smoking. Please look for your doctor for help and recommendations in stopping smoking. What are the symptoms of osteoporosis? Well, often people present with the final product, which is a fracture, most likely in the hip or in the spine. But you can also note some symptoms prior. Some people might have shrunk or decreased in height. This might be to the decrease in the density of the bones in the spine. So seeing if you've lost height over time is important. The second thing is that your posture might appear hunched or curved. Pain in the joints is usually not due to osteoporosis and may be due to another illness, perhaps osteoarthritis. Some illnesses also contribute to the risk of osteoporosis. For example, inflammatory diseases, rheumatological diseases, celiac disease, any problem with absorption. Transplant patients have an increased risk of osteoporosis. Loss of estrogen, which occurs in menopause, and other diseases as well. Medicines are often a culprit in exacerbating osteoporosis. The most important are glucocorticoids. Glucocorticoids are used in many diseases, and they can be life-saving, but effects long-term can really increase your risk of osteoporosis. So it's important to talk to your doctor about minimizing the effects of your drugs. Cancer medications, anti-epileptic medications, these drugs also affect the synthesis and the destruction of bone. How do you treat osteoporosis? Like I said, the most important thing is to prevent it. Once you have osteoporosis, your doctor will assess your risk of fracture and then determine if you will benefit from medication. One tool that they use is a frac score. This involves getting a bone density test, which is like an X-ray of your spine and of your hip. This will be compared to people your own age and also a population of young people. Those scores will give your doctor a risk of how likely you are to develop a fracture. And that will help determine which, if any, medication is right for you. So we often use, as a first-line, drugs called bisphosphonates if they are appropriate for you. We also make sure that you're getting enough calcium and enough vitamin D, that you're able to do exercise, and that you know about fall prevention, and put things in place to minimize your risk of falling. We also try to work with your other doctors to diminish the amount of medications that might be damaging to your bones. The most important thing is to talk with your doctor, be able to assess your risk, put in place healthy lifestyle factors to prevent osteoporosis, and if it does develop, follow up with your doctor to get the treatment that's appropriate and needed. Thank you.